Okay, we're gonna get started. Um, Before we go into some quick introductions, I do want to let people know that this is the first session in English. If you're here for the Spanish session, that is at 7 p.m. But we do want to remind folks that questions can be put in at the Q&A function, and Dr. Rembert will answer the questions at the end of the session. The recordings of the session will be available at the Southwest Organizing Project's YouTube channel later this week or maybe next week. But yeah, we'll go into some quick introductions. First off, want to introduce the organization that I work for. I work for the Southwest Collective. Our mission is to provide an open forum for Southwest Side residents to voice their concerns, hear new perspectives from their neighbors, learn about existing public resources, and launch economic, educational, and recreational initiatives that bring our siloed communities together. More specifically about what we do, we are a neighborhood group dedicated to engagement. We create programs and events that bring our communities together socially through a greater good, such as mutual aid, art education, cultural celebration, with the hope that it gets folks talking and enjoying each other's company. It's through this work that we are able to shine light on inequities, then organize and advocate for each other. And one of our focus is primarily around health equity. So the Southwest Collective is proud to participate in Healthy Southwest and shares the CDPH commitment to reducing the Black-white life expectancy gap and creating a healthier future for everyone in Chicago. CDPH's Healthy Chicago 2025 plan is a call to action across sectors to promote health equity with the understanding that health inequities are rooted in racism and cause harm to individuals and communities. And you can follow us on any of our social medias linked below. Yeah, next slide, please. All right, so a quick introduction about our presenter today. It is Dr. Ronald Rembert Jr. Dr. Rembert is a family physician with experience practicing medicine with a focus on treating the underserved with acute and chronic illnesses. He has been a trustee with the American Association of Public Health Physicians and is currently a board member of the Family Health Foundation of Illinois, a fellow of the American Academy of Family Physicians, a member of the National Medical Association, and has been an assistant clinical professor in the Department of Family Medicine and co-chair of the Community Advisory Review Council, reviewing community medicine research projects at the University of Chicago, and an instructor to medical students at Rush Medical Center. He currently works as a consultant with healthcare entities throughout the United States. Dr. Rembert received his medical degree from the Chicago Medical School at Rosalind Franklin University of Medicine and Science in Chicago. He completed residency at Rush Medical Center and at Advocate Illinois Masonic, and served as chief resident during his last year of residency. So without further ado, I'll pass it over to Dr. Rembert.
Good evening and welcome, everybody. Thank you, Hugo, for the introduction. I'd like to go ahead and get started this evening, but I typically start off presentations like these with a medical disclaimer. So I'll go ahead and read that for everyone. All the content and information shared during this presentation is informational and educational purposes only and does not constitute medical advice nor establish any type of clinician-patient relationship by attending this session. Although I strive to provide accurate general information, the information presented here is not a substitute for any kind of professional medical advice, and you should not rely solely on this information. Always consult a professional medical provider in the area of your needs and circumstances prior to making any professional, legal, medical, and/or financial decision. Please do not delay seeking medical attention or treatment because of something that you've heard, read, or viewed in this presentation. The presenters are not responsible nor liable for any advice, course of treatment, diagnosis, or any outcomes for anyone who watched, listened to, or participated in this presentation. That being said, go to the next slide. Our session topics this evening include overall health, chronic diseases, some high-yield men's health topics, and we'll discuss ways to manage our health, and then we'll end with a question and answer session. So let's go ahead and get started. Next slide. So first topic, overall health. I'd like to present this particular slide, just showing some of the major and leading causes of death that we face here in the United States. And this is from the Centers for Disease Control, their data from 2021 with the leading causes of death. And heart disease by far, along with cancer, over 600,000 deaths annually. And this is just in 1 year's time. Now, as you can see, COVID-19 was responsible for over 400,000 deaths, but we also have included in there strokes, chronic respiratory diseases, Alzheimer's disease, diabetes, chronic liver disease, and kidney disease or nephritis, nephrotic syndrome, and nephrosis, as well as a significant number of deaths from accidents or unintentional injuries. Let's take a look at the next slide. So, what is health? Health is our overall state of well-being, both physically and mentally. And this entails many things, including getting sufficient rest, nutrition, exercise, mental and emotional stimulation, and preventing and treating illness and disease. So how do we have and maintain good health? What are your thoughts? For those who are participating, if you'd like to include any comments or questions in your thoughts, and Hugo and Dr. Reddy, just let me know if people put anything in the chat. But does anybody have any ideals on how to have and maintain good health? Looks like the chat.
We can just ask people to put it into the Q&A function because I don't know why it seems like the chat is not available to everyone.
Yeah, it looks like the chat has been disabled.
Okay.
Sorry about that, everyone. Yeah.
Sorry, I'm not sure how to fix that on my side.
Okay. Well, in the bottom of the page, if you can type in the QA portion, that would be great. But with that being said, let me go ahead and continue. So, how long can we expect to live? What is a typical life expectancy? As of 2021, life expectancy at birth was approximately 76.4 years for the entire US population. And this was actually decreased from 2020 from 77 years. Now for men, life expectancy is a few years less. In 2021, it was decreased to 73.5 years from 74.2 years in 2020. And for men of color, that is even less. Women tend to have a longer life expectancy, and included in this slide, see women tend to live on average about 79 years. And this information is also from the Centers for Disease Control. Let's take a look at the next slide. So let's look at chronic diseases, second topic. Chronic diseases are defined as conditions that last 1 or more years and require ongoing medical attention and can limit daily activities. 6 out of 10 adults in the United States have at least one chronic disease, and 4 out of 10 have 2 or more. Now, the overall cost for treating patients and people with chronic diseases was estimated to be approximately $4 trillion, not billion, 4 trillion by the CDC. It's approximately 20% of what we spend every dollar on in this country, healthcare. So some of the chronic diseases that lead to death on the previous slide talked about heart disease, cancer, stroke, diabetes, COVID-19, chronic liver and respiratory diseases. Now, let's take a look at how these diseases disproportionately affect Black and Latino people. Heart disease, cancer, diabetes, and stroke, these are some of the most common causes of illness, disability, and death. And these affect a growing number of Americans. And many of these chronic conditions tend to be more common, diagnosed later, and result in worse outcomes for particular individuals, including people of color, people in lower income neighborhoods, and others who have pre-existing or coexisting conditions that can place them at risk for poor health. Now, despite decades of efforts to reduce and eliminate health disparities or basically the differences in healthcare and treatment that people receive, these disparities persist and in some cases are widening among some population groups. Now, such disparities don't have one cause, but are created and maintained through multiple interconnected and complex pathways. Some of the factors influencing health and contributing to health disparities include social determinants of health, including poverty, lack of education, racism, discrimination, and the stigma that may be associated with being diagnosed or treated for particular diseases. There are also environmental and community conditions, including how community not only looks, but the resources that the community has, what the residents may be exposed to. And in here, we use examples of violence or advertising, but also even some of the chemicals that are released in certain communities can increase the risk for certain chronic and acute healthcare conditions, as well as lack or resources in particular communities, including lack of grocery stores or lack of transportation and access to healthcare. There's behavioral factors, including diet, tobacco, and alcohol use, as well as in regular physical activity. And then I mentioned the lack of access to healthcare, the availability of, and quality of the medical services in a particular community can very affect many people in particular communities. Let's go to the next slide. For this third section, we're going to focus on a few topics, including testicular cancer, prostate cancer, erectile dysfunction, and men's fertility. We'll go ahead and get started discussing testicular cancer. Now, this type of cancer is typically seen in young people to adults between the ages of 15 and 45 years old. One of the first signs can be a quick growth of a lump or bump on a testicle that can spread rapidly to other parts of the body. There can also be heaviness or swelling in the scrotum, dull or aches and pains in the abdomen and groin. There can also be some discomfort in the testicle or scrotum, enlargement and tenderness of the breast tissue or tissue in the chest, as well as back pain. Now, some of the risk factors that are associated with this include a history of having an undescended testicle. If your testicle doesn't descend down into the scrotum, it's called cryptorchidism, and this can increase your risk of testicular cancer. Family history of testicular cancer can also increase your risk, and we also often see this, or we see this more so, not necessarily often, but more so in young adults aged 18 to 25 and in Caucasians. Now, when should you see a doctor if you're concerned about this? If you have these symptoms that I just described and they're persistent for more than 2 weeks, you definitely recommend going to be evaluated by your physician or healthcare provider so that they can do further evaluation and testing to check and see if testicular cancer is something that they're suspicious and concerned for. Let's take a look at the next slide. Prostate cancer is a cancer that occurs in a small gland, a walnut-shaped gland in males that produces fluid that nourishes and transports sperm. This is one of the most common types of cancer, and typically we'll see this in men 65 years of age and older. Some of the main symptoms include difficulty urinating with decreased force of the urine stream. Sometimes men can have blood in their urine or semen, can have unexpected weight loss, can often have erectile dysfunction, difficulty getting and maintaining an erection. Some of the risk factors include, as I mentioned, advanced age, typically greater than age 50. This particular cancer is seen quite often in African Americans. It's also a risk factor to have a family history of this, as well as to be obese. Now, when should you see a doctor if you're concerned about these symptoms or the possibility of prostate cancer? If you're having persistent symptoms like the ones I just described, definitely want to get checked and make sure that prostate cancer isn't a concern. And there are various tests, including manual testing, that can be done to evaluate a patient for prostate cancer. Let's take a look at the next slide. Erectile dysfunction. As I mentioned in the previous slide, this is the inability to get and keep an erection firm enough for sex. And this can be caused by various things, including stress, chronic diseases like diabetes, high blood pressure, smoking, from damage to the nerves in the area from surgery, hormonal issues like low testosterone, various medications, including blood pressure medications, as well as alcohol, tobacco, and illicit drugs, but also psychological and emotional issues such as stress and depression can also affect a man's ability to get and keep an erection. Now, if you have erectile dysfunction, sometimes it could be a sign of an underlying issue, as I mentioned, some of the chronic diseases that can be associated with it. Now, when should you see a doctor if you're concerned about this? If you have a persistent issue with getting and maintaining an erection, if you have premature or delayed ejaculation, if you have some of the chronic diseases that I just mentioned and are having some of these symptoms, you definitely want to be evaluated by your physician. Let's go to the next slide. Now, part of the reason I present on chronic conditions prior to talking about erectile dysfunction and some of the cancers that we see in men is because we know that there is a correlation between some of these chronic illnesses and some of the illnesses, including erectile dysfunction that we've discussed. Now, heart disease, including atherosclerosis or clogged blood vessels, can be a cause of erectile dysfunction because what we're seeing is blockage in the blood vessels, including blockage in the blood vessels that can lead to the penis that help to maintain or get and maintain an erection. High cholesterol, which is a contributing factor, and some of those cholesterol plaques from the increased cholesterol can contribute to clogging or blocking those blood vessels. High blood pressure, diabetes, and obesity can also be some of the associated illnesses that can contribute to erectile dysfunction, as well as metabolic syndrome. This is a syndrome where you can have multiple associated symptoms and diseases, including elevated blood pressure, high insulin levels like prediabetes, as well as increased fat around the waist and high cholesterol. There are also other illnesses like Parkinson's disease, which is a disease in the brain where your brain doesn't produce dopamine the way it should. And typically in Parkinson's disease, it's associated with movement disorders and tremor, difficulty walking, a specific gait. But in some cases, it can contribute to erectile dysfunction. Also, multiple sclerosis, which is a demyelinating disease that affects the nerves, that can affect your ability to move, to walk, can be a setup for erectile dysfunction down the line as well. As I mentioned before, certain prescription medications can also contribute to erectile dysfunction. There's also a disease called Peyronie's disease. It's scar tissue that develops inside the penis that can affect the ability for a man to get an erection, as well as I mentioned, tobacco use, alcohol use, and other forms of substance abuse. Now, we also look at psychological causes, including depression, anxiety, stress, relationship problems, or other mental health conditions that can contribute to all of these. And as I mentioned, all of these can contribute to erectile dysfunction as well as to other disease entities as well. Let's take a look at male fertility, our next slide. So when we look at men's fertility, it's the ability to cause a pregnancy in a fertile woman, in a man who typically produces approximately 15 million or more sperm per millimeter in their ejaculate, in their semen. Typically, the sperm should have movement of at least 40% of the sperm, and their structure and morphology include oval-shaped head with a long tail. Now, some of the medical issues that can contribute to men's infertility include hypothalamus and pituitary gland issues. Those are glands within the brain that produce hormones that can affect the way that we produce testosterone and other hormones in our body that can affect our fertility. Also, testicular diseases can affect a man's ability to be fertile, as well as sperm transport disorders, as well as advanced age. Now, as men age, our fertility declines, but typically more slowly than in women. The most fertile age for a man is typically before he turns 40 years old, but the sperm motility the ability for the sperm to move normally. The sperm count and shape can decrease by up to 50% after age 50. Take a look at the next slide. Now, some steps to increase healthy sperm, including maintaining a healthy weight and eating a healthy diet. But also, illnesses, including STIs, can sometimes contribute to men's infertility. Sexually transmitted infections such as chlamydia and gonorrhea can cause infertility in men. So we definitely, if there's a concern for infertility, and infertility would be you're trying to get your partner pregnant, and you've been trying, say, a man 35 years of age or younger for 6 months, or in a man older than 35 for a year or more with unprotected sex. If you're unable to impregnate your wife, you and your wife, or you and your significant other, will have to be tested to see what the root cause is. But typically what we would do is test for sexually transmitted infections, as well as look at some of the other causes, including checking the sperm to make sure that it's healthy, that there's sufficient sperm in the semen, and to look at some of the or if the person has other medical conditions as well. We also want to make sure that you're managing your stress, that you're exercising regularly, and avoiding tobacco, alcohol, certain lubricants, including lubricants like Vaseline. We typically recommend using water-based lubricants during intercourse. Some of the other lubricants, like I mentioned Vaseline, but other lubricants that may be oil-based, can affect the sperm count and the sperm's motility or ability to move. You also want to take a look at the medications that people are using and their exposure to toxins, including pesticides. And if working with toxins, make sure that you're using protective equipment and avoiding skin contact with those particular chemicals. As well as we recommend wearing loose fitting underwear and avoiding saunas and hot tubs. Now, as I mentioned, you want to seek help if you're under 35 years of age and have been having unprotected sex for 6 months or more, or if you're greater than 35 years of age and have been having unprotected sex for a year or more and are trying to get your significant other pregnant unsuccessfully. Let's look at our next slide. So this is just an overview of CDC recommendations on how we should manage our health. CDC lists 4 main ways of decreasing our risk for many of these chronic diseases that I mentioned, as well as some of the illnesses that we talked about, erectile dysfunction, prostate and testicular cancer. You want to make sure that you're avoiding tobacco use, improving your nutrition, increasing your physical activity and having regular physical activity, as well as decreasing or avoiding alcohol, as well as illicit drug use. I also recommend regular checkups, meditation, prayer, as well as pursuing activities, hobbies, and interests that you enjoy and give you a sense of purpose. Now, what are some of the things that you do to promote health and balance in your life? And how do these things help you? I'm going to take a look and see if the chat function has been restored. If someone would like to include in the chat, what are some of the things that you do to promote health and balance in your life? Go ahead. The chat function should be available. Okay. Chat function is still not working. Okay. Looks like there is a question in the Q&A function. Since men can't be tested for HPV, if the virus goes undetected, can it cause infertility or other health issues? Typically, HPV, or the human papillomavirus, causes more warts, but can contribute to certain types of cancers as well. Infertility, from my experience and understanding, may not necessarily be an issue with HPV, but genital warts definitely is commonly seen with the HPV infection, as well as I mentioned, certain types of cancers that can be associated with certain types or subtypes of the HPV, that virus. There are vaccines or a vaccine that's available for HPV that's typically given to young people and young adults, or can be given to people. But at the same time, that particular or those particular vaccines only cover certain subtypes that are considered higher risk for the cancerous types of the HPV virus, the human papilloma virus. Excellent question. Are there any other questions?
So sorry, everyone. I just realized I did change the settings back to chat, but I'm gonna have to relaunch it between sessions to for the changes to take effect. So we'll do a relaunch between the English and Spanish sessions. So if there's anything you would like to share via chat, you could just put it in the Q&A section and we'll still get it.
Thank you, Dr. Reddick. Were there any other questions, comments? No, I want to thank everyone for attending, and I'm not concluding as of yet. I still want to give a few more moments for people who may have questions that they would like to ask. But definitely appreciate you attending this evening. And after this, I know that Dr. Reddy and Hugo will share some more information about the Southwest Organizing Project as well.
Thank you, Dr. Rembert. I guess, well, if people have any other questions to add on there, in the meantime, I can pass it over to Priyanka to present information on the Southwest Organizing Project. In the meantime, folks, if you have any other questions, you can put it in the chat box if it's enabled now, or in the Q&A function.
Hi, everyone. My name is Priyanka Reddy, and I'm a health equity organizer at the Southwest Organizing Project. We do have public health ambassadors that we integrate within our community to sort of help with wraparound resources for community members. We do have some programs available that are seen listed on the page. So that includes Medicaid for immigrant adults and seniors, that's 42 plus and 65 plus respectively. We also do material needs such as food, clothing, and even SNAP benefit enrollment. If you're looking for behavioral health or counseling, we can refer to other organizations. We do have some employment opportunities within our organization. We do city key appointments once a month by appointment. And we also have a team that works on citizenship, DACA, legal aid that we can refer to so they can talk to you a little bit more about it. We do have some other areas of our teams working. So if you have any of these needs, you can scan the QR code on the right or use the link that I'll be putting in the chat shortly. And one of our public health ambassadors can get back to you and help you find a referral that you're looking for. So if you have any other questions for me, Dr. Rembert, that you didn't feel comfortable putting in the chat, you're welcome to email me. My email is down on the slide below. It's pready@swapchicago.org. So thank you for attending this evening. And if you want to listen to the Spanish session, that will be starting at 7 p.m. Thank you, everyone.